Story 1. If there is a right to choose how to die, then it should be available to all. A peaceful death is better when you know you have fulfilled your desires. Story 2. Having been through the process with a friend and a family member here in Australia, I am fully supportive of it. It is heavily regulated but still available for people with terminal illnesses. Sitting with a friend in stage 4 of cancer, who faced immense pain, and witnessing him leave this world on his own terms with dignity was an honor. A family member whose cancer returned chose her time and place surrounded by family instead of enduring months of chemotherapy that would have resulted in a low quality of life. This should be a fundamental right. Story 3. We should all have the right to choose when we die. We euthanize animals at the end of their lives to alleviate suffering, so why can't we make the same choice for ourselves? Providing a safe, painless option for ending one's life could reduce traumatic suicide attempts. I believe this should be regulated with thorough assessments conducted before any decision is made. It should be an option. I do not want to be bedbound, lose my mental faculties, or endure a slow and painful decline due to an illness. Story 4. It definitely has its place in the world. We all have our own lives, and we should be able to make choices on our own terms with dignity. Whether due to depression, loneliness, terminal illness, or chronic pain, there will always be a need for a legal option for individuals who wish to end their lives on their own terms. However, it should be closely regulated to prevent cases where someone might take their own life due to emotional manipulation. Story 5. It should have already been allowed, in my opinion. In some European countries, it is permitted for the terminally ill, but I am not sure how it works in other cases. I remember reading about one woman who was depressed her entire life and nothing helped, so she was assisted, which sparked huge controversy. For those who are depressed, I believe it is also very much needed. While there is empathy and understanding for the terminally ill or people in pain, there is often a lack of empathy for those suffering from depression who do not want to live. Many people do not show understanding for that kind of suffering. Therefore, euthanasia is definitely a much-needed option in this world. Story 6. I am a veterinarian. It is unfortunate that we cannot provide this peaceful option for our loved ones. There are far better ways to pass than to endure the suffering my grandparents experienced. Story 7. People should not have to suffer in their final days if they are terminally ill. Let them go out peacefully. We euthanize animals for that reason. Why can't humans be euthanized as well? Story 8. It should be widely available. Nobody should be forced to live through a terminal illness because someone else has a moral objection to it. Story 9. After experiencing the prolonged deaths of 2 close family members, it is both shocking and inhumane that we do not allow euthanasia. Story 10. I take care of my grandma, who is 88 years old. She has 3 living siblings. They are still here, but only in body. 2 of them are in a care home where someone feeds and washes them. Sometimes they are put in a wheelchair to enjoy the garden. The 3rd sibling is at home with her husband, who is 92, and her son, but they will also reach their limit soon. Is that life? If I could sign to die in peace as soon as I become like that, I would do it this second. Story 11. Good idea. As I have said many times before, I am not scared of death. I am scared that it will hurt. My uncle had a tumor in his spine that slowly pulled his vertebrae apart, putting him in excruciating pain, while nothing could be done to help him. An injection would have been a mercy at that point. Story 12. Legal in Switzerland and should be legal in the United States. This may be a controversial opinion, but if living is a right, then so is dying. Story 13. No one should be kept alive against their will. That is often torture. People should have a choice. Not everyone wants to be confined in a bed with an oxygen tank or require so much pain medication that they lose track of time. Prolonging life under any circumstances can be degrading and robs individuals of their dignity, autonomy, and freedom. Story 14. I'm in Canada, where my mother's death was assisted by a doctor through a program called Medical Assistance in Dying. She requested this service when she was admitted to hospice. We helped her fill out all the necessary paperwork, and she was interviewed by several doctors to confirm that this was her decision and that no one was pressuring her. Story 15. I am very glad it exists. I had a loved one with colon cancer who died before euthanasia. There is no dignity or much to live for up until the very end. You become emaciated, skin and bone. You can't do basic things anymore. You are in pain even though they provide a lot of medication. The last 2 weeks ended in a coma. It would have been better for everyone involved to end it 3 months earlier. Sometimes it is better to just end it knowing what will come, because medical professionals know upfront what the disease looks like at every step along the way. I am happy knowing that if something similar were to happen to me, I can choose when and how it ends. Story 16. I work in healthcare in a state where it is legal. I support it because it is currently tightly regulated to prevent abuse. I have seen some individuals suffer for months with terrible illnesses. It is horrific and undignified. It brings me relief when people can choose to withdraw treatment and find comfort. Story 17. It cannot be right that our society works so hard to keep severely elderly people alive after they have permanently lost all capability to have any quality of life. I often think about my grandfather, a respectable person when able, facing such an undignified situation. If we permitted it for people aged 80 and older and no one else, I still believe we would be making mistakes and neglecting many issues, but it would be an improvement over the current situation, and I cannot see any drawbacks. Story 18. My mother's friend was not allowed euthanasia and died a slow, horrible, painful death. If they had been permitted euthanasia, they could have passed away with dignity and comfort, surrounded by their family. Story 19. I have always supported it. My opinion has become even stronger since my beloved grandma slowly passed away over the course of a week after her kidneys failed due to the cancer medications she had to take. It was heartbreaking to watch her suffer. At least she was in a nice hospice, and they took excellent care of her during her last months. She even helped the staff as long as she could by comforting and talking to other patients. Story 20. I wish it were legal here. We had to watch my wife's grandmother spiral deeply in her battle with severe dementia, and in the last couple of years of her life, she was begging for someone to end her suffering. We witnessed her completely decline until she was no longer present. Then we just waited for her body to give out. It was terrible, and she did not deserve to suffer that long. Story 21. Positive even for people with dementia. I have watched too many relatives fade away until they become an otherwise healthy shell of their former selves. I filled out a do not resuscitate order, and I wish it covered death with dignity for Alzheimer's and dementia. Story 22. I believe we should have the right to die if it is for medical reasons. I watched my grandfather wither away with motor neuron disease for 10 years. He gradually lost all ability to function, including the ability to swallow his own food. At one point, he tried to choke himself to death with biscuits. He begged the nurse to assist him in dying. He spent several years after this point locked in his own body, with his brain perfectly unaffected. In this case, he should have been allowed to choose death. Story 23. As someone with extensive experience in end-of-life care, I believe it should be an option. However, I also think that the average person significantly overestimates how often individuals would choose this option. Story 24. My mother had a degenerative disease that gradually caused her to lose all muscle capabilities. Every movement became increasingly difficult over the years. It started with her inability to open soda bottles and similar tasks. A few years later, walking became challenging, and she would begin to fall. Eventually, she was placed in a chair, but the muscles needed to keep her upright lacked the strength, causing her to occasionally tip over onto the sofa. Later, when she moved to a care facility, she lost the strength to breathe and swallow. She spent years suffering before passing away. It was sheer luck that I did not inherit this disease. If I had, I would be at the forefront in my country advocating for the right to end one's life with dignity. Otherwise, I would face the same fate she did. Story 25. Patient dignity and the right to access medically assisted dying go hand in hand. There are no two ways about it. That being said, I agree that it should be regulated due to safety and ethical concerns. Story 26. I fundamentally agree with the right to die with dignity, but I believe it must be legalized in a society that provides sufficient support and medical aid for terminal and degenerative conditions. Euthanasia should not be a solution that people feel compelled to choose due to a lack of access to other options they would prefer to pursue. That is essentially eugenics with additional steps. Story 27. I have a pen ready. Just hand me the papers and let me erase my search history. Seriously, everyone should have the option to end their lives on their own terms. Witnessing what my elderly parents experienced at the end of their lives filled me with contempt for those who insist on prolonging life at all costs. Story 28. People commit suicide frequently. Now, this option is available for the elderly, those who are weak, or generally anyone who cannot do it themselves, and very importantly, it is done with dignity. No more secondary victims of suicide, such as relatives finding loved ones in distressing situations. No more traumatized train drivers. Nobody has to clean up the aftermath. Additionally, many people emphasize that this is a means to end suffering. We do it for our pets, so why not for ourselves? Story 29. I'm a doctor in Switzerland, where we at least have assisted suicide, which I support. I would also favor medical assistance in dying, but with more regulation than for assisted suicide. Story 30. I worked for a long time managing hospice medication deliveries, and most of my drivers were nearing elderly age themselves. After a year or so, each of them was willing to be dismissed at the first signs of cognitive decline. You do not understand how challenging dementia or end-of-life care can be until you work with these individuals and witness their prolonged suffering. Dying on our own terms should be a fundamental right. Story 31. If a person is intent on ending their life, it is difficult to stop them. Why not make this part of the healthcare industry? The benefit is that the patient dies with dignity while the medical services receive compensation. Story 32. I support it. Those against it are often the most selfish and entitled individuals. We show dignity and humanity to most of our pets, yet we struggle to extend the same treatment to a fellow human whom we claim to love. Story 33. I am pro-euthanasia. Those who have not experienced a certain kind of suffering should not be in charge of deciding whether it should be allowed. Story 34. For individuals with terminal physical illnesses, I believe it is a wonderful option. I do not want the last days or weeks of my life to be spent in confused agony. I have mixed feelings about euthanasia for individuals who are disabled or mentally ill. I wonder if society genuinely provides every opportunity for people to thrive within their limitations before death appears to be a viable option. Story 35. I keep my passport up to date in case I have to travel to Switzerland later in life, so I support it. Story 36. As long as it is voluntary and consensual, I support it. Much of the disdain for ending one's life with dignity comes from religion, which holds back progress in society and humanity. Leaving religious indoctrination behind, there is no reason why a person who credibly and honestly wishes to die should not be allowed to do so or receive help in their pursuit. One could argue that improvements are possible after a bad breakup or a lost job, but such situations can be random. When there is a visible, understandable, and provable benefit to choosing to die rather than continuing to suffer, who are we to deny someone in pain the freedom they seek? Honestly, considering the current skyrocketing population numbers causing crises such as lack of housing, food, medical care, and education, I believe that a few thousand fewer people each year who choose to exit rather than continue in pain would not significantly impact society, especially if they have already lived a long life. Humans are not designed to last 100 years or longer. Those who do are exceptional cases. Medicine has allowed human bodies to persist longer than the previously normal 40 to 50 years. So if individuals from that extended age group decide they are in too much pain to continue, why should medicine not assist them? Story 37. I used to be against it, but after seeing so many people who have dementia, Alzheimer's, cancer, and other medical issues, I think it's a great thing that gives individuals the ability to control their destiny. However, I am against it for mental health issues like depression. There are many treatments available, and no one should be left without access to them. Story 38. You have to go through years of therapy and paperwork to be considered for it. I sincerely believe that if you want to leave, you have the right to do so on your own terms with dignity. Anyone saying otherwise has never lived with chronic severe illness or pain, or truly witnessed it. Anyone who truly wants to go will eventually do so, with or without assistance. This way is far less traumatizing and more humane for everyone involved. Story 39. Recommended reading. Being Mortal, Medicine and What Matters in the End is a 2014 nonfiction book by American surgeon Atul Gawande. Story 40. I believe entirely in the principle of my body, my choice. I should be able to choose how I live and, therefore, how I die. My most important argument for this perspective is that it may help prevent suicidal individuals from causing trauma to innocent bystanders, such as jumping in front of trains, jumping from buildings, or hanging themselves for their family to discover. Story 41. I recently had to euthanize my elderly dog on Christmas Eve as his condition declined quickly. We took him to the veterinarian, who showered him with love and treats, including ham, cookies, chocolate, sausage, and cheese, all of which are harmful to dogs. Many staff members came to pet him and say goodbye while they started the intravenous line. After he returned to us in the room with the line in place for his final goodbyes, even more staff members came in to say goodbye. He died in our arms, happy, secure, and painlessly. I would like to go the same way, as I believe people deserve the same dignity. Story 42. As U.S. healthcare struggles due to the competency crisis and staffing shortage, it is likely to become common in 20 years. Story 43. I believe it should be used for individuals with terminal illnesses who have the capacity to understand and give consent. Story 44. I hope it becomes available on demand for everyone. I would use it when I grow older with diminished capacity. I cannot depend on my wife and children, who would rather see me gone for money. Story 45. For terminal illness, absolutely. Nobody should suffer. We do better by our pets in that regard. I used to be completely in favor of it, but I watched an episode of Trigonometry where a woman discussed how people with mental illness die at such a high rate due to a lack of hope. I can't help but think of times when I felt low and believed my life wasn't worth living. I don't think I needed to die. I needed community and hope that things could be okay. Story 46. I wish non-medically assisted death were legal. You could sign a waiver, choose how you want to die, and the organization would arrange everything so you could go out on your terms. Your life insurance would cover the costs, which I believe it should, even though it often doesn't pay out for suicide. For me, I would choose death via wingsuit. I would leap out of a plane and glide down alongside a mountain, taking in the scenery, and when I'm ready, I would just tuck my arms in and plummet. Story 47. In my opinion, it is a lawful way to die without causing consequences after it happens. Additionally, it involves the person's consent for medical professionals to assist in this process in countries that legally allow individuals to make this decision for themselves. Story 48. Good on a case-by-case basis. There are many more questions regarding the larger societal consequences of making it legal. Story 49. My pet dog had a better end of life than either of my parents. Under carefully controlled circumstances, I am a big fan of voluntary assisted dying for individuals with terminal illnesses. My mother would have definitely taken advantage of it if it had been available. I do not think my father would have. Story 50. I believe it is a classic example of the road to failure being paved with good intentions. We have seen the consequences in other countries where it has been used on children and individuals with no physical ailments, or offered to disabled individuals instead of the care they truly need and deserve. This should be enough to end the debate for good. Yet it continues because people are too often guided by their emotions. Story 51. If there is permission from both the patient and their family, then I support it. Sometimes, the only way to end the suffering is to end everything. At least the patient can finally rest in peace. Story 52. People should have the right to die with dignity and not suffer through a horrible life-ending disease. Story 53. As long as the person is of age and consenting, I don't see the harm. It would save many people pain. Personally, I would have undergone it myself when I was 18 if I had the ability to. 7 years later, I would not. But that has more to do with exhaustion than anything. Story 54. Much like capital punishment, I have concerns about the character of those administering the policy. That does not mean no. It means I have concerns. Story 55. I believe we should all have control over our own bodies, including the right to die on our own terms. Story 56. My beloved dad has Alzheimer's disease. He no longer recognizes any family members and cannot always remember how to walk. I know that if this illness is allowed to run its course, he is going to forget how to talk, smile, and eat. I hope that if I am ever diagnosed, I will be in a sound mind enough to choose euthanasia as soon as possible. Story 57. Even if it is not legal, it happens all the time. It is often accomplished through narcotics, and I sincerely hope they are administered to me on the way out. Story 58. If it is used to alleviate the pain and suffering of dying, to ease the transition from this state to the next, then it is no different from medically assisted birth and should not be denied. Story 59. We should have the right to choose. We have the decency and empathy for our pets to end their suffering. This would also alleviate the worry about when and where one would die. There would be a specific date and time. Your loved ones would know this and could be present. It would not be unexpected. I believe a degree of suffering for loved ones would be eased by knowing exactly where, when, how, and why. Everyone gets to say goodbye. Story 60. Unless nursing homes and healthcare are free, I am against it. By giving the patient a choice, you are effectively making them responsible for the money their relatives spend on them. This can pressure many low-income individuals to harm themselves to avoid being a burden on their family. Story 61. I will willingly sign up. I have no children, have never been married, and I have experienced irreversible health damage. The current political climate in the United States is making my decision easier to retreat and disconnect. Let people like me go while others who embrace toxic positivity continue to deceive themselves into staying. I would completely support assisted exiting. There are too many of us here for the wrong reasons, stemming from the poor decisions of our parents. Story 62. Yes, please. It is a shame and a disregard for humane care. In the United States, we can euthanize an animal in a dire end-of-life situation, but we have to sit by the bedside of a terminal loved one for days on end. I experienced this at age 21 for my mother, with a hospice nurse at the end of her stage 4 metastatic breast cancer fight. Now, here I am, 38 years later, almost 5 years into my own fight with metastatic breast cancer, stable and still fighting through chemotherapy. I do not want my husband and children or myself to go through those last agonizing days when there is nothing left to be done. It is very possible to administer a medically driven and controlled process to prevent misuse. However, self-appointed authorities seem sure they have the right to dictate over all humans from the first grouping of cells until our last breath. It is not about what is best for us at any age or stage. It is simply the assertion that we will be treated in a certain way because they said so. Story 63. Why is living in pain required of me? Whether it's mental or physical pain, we euthanize animals that are in pain without hesitation, but we humans are forced to suffer through inhumane conditions, often against our own will. It should be our choice to seek relief. Story 64. I wrote an essay supporting euthanasia in 6th grade because I could not understand why we would alleviate our old dog's suffering but not do the same for my very sick and dying grandmother. She did not want to be here. My essay received an A+, but I also received a reprimand from the administration because they thought I was unstable. I was not, and I am still in favor of euthanasia 45 years later. We are supposed to be a compassionate society. Story 65. For my beloved pets, they can have a painless and dignified death. I know this because I am present for the entire process. Unfortunately, humans, at least in my state of Tennessee, are not granted this luxury due to outdated beliefs. This is not the only misguided legislation here. My state has many similar issues. Story 66. For those with pre-existing conditions and a thorough psychological examination, let them make their choice. Suffering is not dignity and should not be imposed on someone against their will. Story 67. My grandfather died a few years ago through medical assistance in dying in Canada. He was in his 90s and had gone through rounds of illness and recovery. Recovery was becoming increasingly difficult, and with a new round of illness, he told his sons he was ready to go. The medical team took him off any medications that could cloud his judgment and conducted due diligence. A few days later, they administered the medications to end his life. It was calm, peaceful, and painless. My mother has advanced dementia. Decades ago, when I was still a teenager, she told me in her serious voice that I was to take her into a forest and shoot her if she ever developed dementia. For all the obvious reasons, I could never do that. Now she is in a long-term care home, and every few days I receive updates about her falling or struggling with food. If she could have signed a document outlining her wishes, I believe she would have opted out. So I support it. Absolutely. I think if more knowledgeable individuals could figure out a way to make it robust and resistant to abuse, advanced directives should be allowed too. Story 68. The current end-of-life care we offer is inadequate. If you are diagnosed with a terminal condition and wish to end your life on your own terms, you should be fully supported in that choice. Much of what we currently provide is based on outdated principles, which is unacceptable. Story 69. I believe it should be legal and hopefully accepted one day. However, the issue lies with legal matters such as life insurance policies and other probate problems. Many policies may contain clauses stating that they would not pay out if this method was used, as it could be viewed as a form of suicide. Numerous policies include exclusive denials for suicide. Additionally, it could raise concerns about mental health if a will is completed shortly before death. I can see arguments on both sides regarding the soundness of their choice and whether they may be considered unsound for making that choice. Story 70. Although medical aid in dying is for the patient, it is also a gift for family and friends. Knowing when death will happen and being able to be present with their loved one is significant. Provides closure and a sense of calm. Having the ability to choose how and when to leave this earth is a right that everyone should have. Avoiding the often difficult aspects of the end of life, such as chronic pain, shortness of breath, and the inability to use the restroom independently, is important. Story 71. I support euthanasia, especially for the terminally ill. This includes not just the elderly but also children with genetic conditions that would lead to a short and painful life. However, there is significant potential for misuse. Who decides the criteria for who qualifies for euthanasia and who does not? I know several people who would unjustly advocate for euthanizing a dying parent to inherit assets that were not left to them. There will be parents who may want to end the life of a severely ill child who could have a chance to survive with proper care. In cases involving children, who provides consent? The child or the parents? Additionally, there is the ethical concern of interfering with the laws of nature. It may seem abstract, but we cannot take lives if we did not give them. Yet, we euthanize suffering pets regularly, so who is to say what is right or wrong? Story 72. Having the right to choose how we die is just as important as having the right to choose how we live. Story 73. I support it for both mental and physical issues. I have severe depression and have dealt with it my whole life. I have always known this is a terminal illness for me, despite experiencing good moments occasionally. One day, I will take the steps I constantly think about. This will likely be something painful, scary, and traumatic for both me and those who find me. So why can't I do it in a way that minimizes pain and trauma? Why can't I have a positive way to leave this world? Why must I live for you when you do not experience my pain? Story 74. It's great. The laws should be relaxed surrounding it. If you are terminally ill and have given permission, they should be able to proceed even if you cannot physically nod. Story 75. I am strongly supportive. In my career, I have witnessed tremendous, prolonged suffering that was often unnecessary. Story 76. I loathe the idea of being kept alive by machines just to ease someone else's conscience. I don't care what their religion tells them. My children all know to pull the plug. Story 77. It's my decision, and it really frustrates me when some politicians want to decide how much I should have to endure at my end. If they want to suffer, that's fine. But keep your beliefs out of my business. Story 78. When the orange obscenity cuts off my Medicare and Social Security, it's my last resort. Pain-free would be nice. Story 79. To allow this, we would need a robust legal framework. I support the right of individuals with terminal or chronic illnesses to end their lives if it means alleviating their suffering. However, I am concerned about the implications if the government were to declare all individuals who are gay or autistic as ill and recommend medical euthanasia as a solution. Story 80. I support the idea of euthanasia only under very controlled settings, and only after consulting multiple experts regarding the patient's condition. To provide a comparison, some of my family members have undergone gastric bypass surgery. One family member, in particular, had to attend 10 separate appointments, including evaluations by psychologists, to ensure she was of sound mind when making her decision. A similar process should be implemented for euthanasia. Is the individual mentally competent to make this decision? Are they truly terminally ill with little to no chance of recovery? Has their quality of life diminished? Are they being coerced into ending their life? A clear process is necessary if euthanasia is to be legalized. However, I doubt this will happen in America. There are too many people who believe that any life is universally better than death. Story 81. I believe it is a beautiful dream to be able to end your life when you choose. However, I do not think we have a society or government that would allow it to happen ethically or safely, so I would prefer that we focus on having the best palliative care in the world before considering assisted dying. Experienced end-of-life care assistant. Story 82. In theory, I agree with people's right to die with dignity. However, I suspect that in practice, this may be used as an excuse for wealthy individuals to abandon vulnerable populations. Can't afford cancer treatment? Can't find suitable housing for your disability? Then you may be pushed toward dying with dignity. Story 83. When a person chooses it as their best option, it is acceptable. However, when someone is compelled by external withholding of resources from a system that aims to eliminate parasites, it is deeply troubling. Story 84. I believe it should be a guaranteed right, but it also needs to be accompanied by an equitable healthcare system. There are already stories emerging from countries that have adopted legal euthanasia, where disabled individuals feel pressured toward it simply because the world has not fully embraced assistive technology or because home health aides are hard to find. These situations, among others, are often used to dismiss the reality that an already vulnerable population is being led to feel like a burden by those in power. So yes, it should be an option. However, it should never be introduced by a healthcare provider. The patient should initiate the discussion, and only after all other avenues have been explored. I also understand there are limitations to my vision of this model. There will be individuals who may not have the capacity to fully consent once all their other options have been exhausted. To address this, official documentation could be created. We already have living wills and power of attorney documents. What would be needed is another form detailing the circumstances in which a person would prefer to die. Story 85. I agree with it, except for individuals who have botched their own suicide attempts and then dedicated their lives to helping prevent suicides. There are too many of these individuals for me to support euthanasia, except in terminal cases. Story 86. I feel the main issue would be if doctors are coerced into performing euthanasia, as it raises serious ethical and legal concerns. Additionally, it blurs the role of doctors who are meant to save lives. Story 87. I am concerned that some people who are very ill may seek death if they are depressed, not necessarily because of their illness. They might be able to pretend to be sicker than they actually are. Story 88. It should be technically possible but ludicrously stringent and take a minimum of 5 years, more like 10 or more, to process. If any doctor, medical employee, government employee, bureaucrat, administrator, or politician can be shown to have exerted the merest amount of pressure for the procedure to occur, then they are automatically guilty of first-degree murder. All licenses should be immediately and permanently revoked, and all property and assets of both the individual and any companies or trusts associated with them should be confiscated and handed over to the family of the victim without delay. All companies and political parties associated with them should be suspended for a minimum of 10 years pending a thorough investigation. The individuals involved should be sent immediately to federal prison, along with any potential co-conspirators. They can use a state-appointed attorney to appeal their convictions as separate cases, which can never be bundled, including conspiracy convictions separately involving every other arrestee in the case. If they are subsequently found innocent of all convictions and have spent less than 40 years in prison, while working through the appeals process. It should trigger a red flag indicating potential state corruption in the case. All government employees involved should also be arrested and jailed as co-conspirators and undergo the same legal process. It should never be a financial or social benefit for anyone in power to promote the harm of citizens, not even through coercion or withholding other solutions to their problems. It should remain technically possible only in the most extreme cases, and if it ever rises above 0.0001% of the population, that should trigger an immediate review. What is currently happening in places like Canada is incredibly wrong and effectively an intentional genocide of their disabled population. The Die with Dignity slogans are shielded expressions designed to protect psychopathic bureaucrats and politicians from having their true intentions exposed to the public. Story 89. Legal organ harvesting is concerning, as it can lead to people becoming depressed and doing it for profit. I am against it. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.